Alright guys, here we are again, and this is a little video that I've had a lot of requests for. It's pretty much the most common problem you'll see with powerlifting is back pain, and in particular extension-based back pain, so pain associated with leaning backwards. When we look at the mechanics of powerlifting, whether you're squatting, bench pressing, or deadlift, you've almost always got some degree of arch in the back, particularly as you start to struggle. You get closer to your 1 RM and you're not quite able to keep that neutral spine that we all want. The tendency is to overarch, particularly if you're an arch bencher. The mechanics of that, all three positions back are arched. Muscles like the lats and the erectors, which help extend the upper back, are always engaged on all three lifts. And we look at the type of volume that you do as a competitive lifter. You could be doing 10, 12, 15,000 pounds of squat volume per workout, and then add that on top of maybe 1 to 3 workout sessions per week, per lift, depending on what type of programming you're doing. So, there's a few things we need to know about why we have that extension-based back pain. Essentially, the biggest problem I see is with you think it's a back problem, but it's often an issue of tight hip flexors. Because for the same reasons, if you're doing squat or deadlift, you're almost always in that hinged position. And again, those hip flexors tend to get tight. So if we look at our model here, picture muscles like psoas, muscles like rec fem, that pull your leg up, they can have a reverse action, origin insertion, so they can actually pull your spine down towards your hip too. So imagine a bungee cord coming off the front of your pelvis, pulling down when it gets tight, doing that type of movement. This is exaggerated, of course, but when it pulls down that pelvis into that really tilted anteriorly position, look at what happens to the back. So here's neutral, and you can see all these facet joints have a little bit of breathing room. Pull down on the pelvis with tight hip flexors, all of a sudden they're crunched up together, and all of a sudden, I've got back pain, what's going on there? And you oftentimes don't even realize that it's coming from the front of the hip. So, what is extension-based back pain? A lot of it comes from, again, we talked about the positions and the time in those positions and the lifting volumes. But if you've got extension-based back pain, some of the basic signs are, pain with extension. So pain when you lean back. Easiest way to do that, put your feet together, lean back. Does that give you your pain? That's the most obvious one. The second most obvious one that we see in lifters is that really stiff back in the morning. So stiff in the AM, you have to log roll out of bed, you feel really tight through here, you want to crawl to that hot shower to get some relief. Symptoms when you're lifting, if you're squatting and you're descending, you tend to feel a bit shaky, because what's happening is as we push our hips back into the squat, so as you're hinging down and that spine goes from vertical to more horizontal, what happens is your multifidus muscles all along the rims of your vertebrae, they tend to kick in to prevent you from collapsing forward. And when they activate, they actually arch you more for stability, so they aggravate that extension. So shaking or hitching with the squat on the way down. So shaking with squats, and conversely, squatting and deadlifting, pain when you come up. So as you're ascending with the squat bar, as you're pulling up with the deadlift, if you arch at the back, you'll see that pain come up. So pain with ascent on the squat or deadlift. Other ones we'll see, again, maybe pain side to side, not as much. These will be the big ones. Things to know as well, if you do have some back pain, kind of red flag symptoms that would indicate to you, hey, I need to go get this looked at immediately. This is nothing minor. First and foremost, bladder and bowel dysfunction. So bladder bowel problems, go get that checked out. Pins and needles, numbness, pain in the legs. Now those might tell you that something more serious is going on. So if you got any of that, run, don't walk, go see a doctor. If it's just local pain with extension and with these type of movements, it's probably just that mechanical back pain. Some more issues we'll see outside of these. Now it is possible with facet joints that you could have some of that, particularly maybe pain in the legs, but I always be more cautious with that. Oftentimes with this extension-based stuff, it's going to be local pain. Some people also have SI joint pain. So, SI joint, again, that little joint right there, dimple on the back, a lot of people tend to get pain there. Might not always be the issue. Sometimes L4, L5, they have referral pain patterns that will go right to that SI joint as well. So again, that might be more facet, but again, those SIs can get irritated too if you're particularly overarched. So, what can we do about it? I mean, there's a number of culprit muscles. We talked about hip flexors. QL is another big one. So we obviously want to tackle those type of problems. So in the order that I typically see them in patients that I've worked with, lifters that I've coached, number one is psoas. Sometimes iliacus as well, but mostly psoas. Second one down, rec fem. Third, QL, which is just, low back muscle. Runs either side of the spine from 12th rib down to the crest of the hip. So acting together, they can pull you back, but if one's overactive, it'll tend to pull you back into one side. And to be honest, in lifters, there's always one that's overactive simply because of your deadlift grip. So again, if you're looking at the pronated versus supinated side, so this is my supinated side, I might favor that side a little more. And when I do that slight hip shift, this one tightens up and my hips go that way. All of a sudden then this QL is too tight and I'm just clamped down more through here. So let's take a look at relieving some of this stuff. So starting at the top of the list, psoas iliacus. I always found banded stuff the best. So coming up into a hip flexor stretch, neutral pelvis, rotate forward, lunge forward. Get a band on this hip. Please do yourself a favor. Hook it around the glute so it's pulling that way. Okay, hook it up to the squat rack, hook it up to the bench, hook it up to the Smith machine. Just get a band on there and have it pull you into this stretch more. Highly, highly effective. Number one thing that saved my back when I was going through these problems. So that's psoas iliacus, rec fem. Classic couch stretch. So easy to do. Just this position, abs on, okay? Gonna get rec fem, gonna get a little bit of iliopsoas, a little bit of hip capsule. Again, abs are on, I'm upright. Can I lean back, stretch out, all that. So again, both of those are gonna be for the hip cord musculature that we've got here in the front. Again, we think those pulling down, rocking that pelvis. 2 minutes at least per leg, per round. So if you're doing it for less than 2 minutes, you're fooling yourself. You're not going to make any long-lasting change. So do yourself a favor, 2 minutes each leg, each of those before bed if you're having these problems. Okay. QL, again, we know top of the hip crest up to that 12th rib. So what we're going to do, pop the foam roller down, get it there. Okay, so find your hip, get in on it, arm is out, roll around, hunt around. I'm pivoting backwards and forwards, hitting it at different angles, okay? Get in there, find nasty bits, spend some time there. If you've got a rumble roller with little knobs on it, even better for hitting QL. It's pretty deep in there on some people, so the rumble roller will actually help get in there a little bit more. Alternatively, you can get a lacrosse ball, put it right at the top of the hip. So find that bony hip crest, okay? Come up off it, roll it off to the side. Again, you're going to be aiming between that hip crest and the bottom of that 12th rib. So in that kind of quadrant there, dig in, put it against the wall, lay on it, do something, break up tension there. So now, those are the top three. You know, other things you have to consider if that's not helping is lats. You know, lesser extent, but not totally uncommon. Again, we think about powerlifting, squat, bench press, deadlift, squat bar, pulling down, lats are on, bench pressing, twisting, lats are on, deadlifting, twisting again, keeping the bar close to the thigh, lats are on. And we know from McGill's work that the lats will actually work as a secondary extensor of the lumbar spine just due to their attachments low on that thoracolumbar fascia. So loosen off your lats. If this stuff isn't helping, dig into the lats. You can try rolling out your erectors, but in my experience, unless you take care of these, particularly the first two, you can roll your erector spinae all you want. It's not going to help. It's going to keep coming back until you clear these up. So there you go, guys. Familiarize with those symptoms are. Give those three a try, okay? Be cautious if you got any of those, go get help. But I hope that helps. This is something that again has been requested so many times, and it's just something I see constantly. Nearly all of us will have to deal with some type of back pain in our competitive career, so this should give you at least a starting point for tackling some of it. So there you go. Hope it helps. I'll see you next time.